I am Dr. Vadiraj, HOD and consultant radiation oncologist, Manipal Hospital. Tumors with respiration or breathing move up to 2 to 5 centimeters, especially in lung, liver, and pancreas. We did not have any technology to track this so far. When we see 10-15 years back, the treatment of the tumor were with a broad field encompassing the normal structures. But with advancement in technologies, we now precisely target these tumors. Tumor tracking is one of such technologies wherein we can actually target the tumor without excessive dose to the surrounding normal structures. So earlier there were technologies like holding the breath or active breath coordinator, wherein we used to ask the patients to take a deep breath and hold for 20 seconds, and during that time the radiation beam used to be switched on and we used to treat the tumor. And then we had to ask the patients to breathe normally and again ask them to take a deep breath and hold, and the treatment used to happen only in the breath hold period. But this was quite cumbersome for the patients as they had to take deep breath and hold for 20 seconds nearly 10 to 20 times during the treatment. Another technology, real-time positioning in some of these machines, wherein the patient keeps breathing normally but the treatment happens only during one of the phase of respiration, that is during inspiration. But since the treatment happens only in one phase of respiration, the overall treatment time used to be almost 30 to 45 minutes, and that also would be quite cumbersome for the patient. So this Radixact 9 with Synchrony, with this technology, the greatest advantage is for the patients who have tumor in the lung, liver or pancreas. This technology basically helps in tracking the tumor and treating it exactly without giving excess dose to the surrounding structures. This is introduced first time in India, and it was introduced in the world in 2019. Earlier to this, we had different technologies to address this respiratory movement either by breath hold or by real-time positioning, which used to take long time. But since this technology is available for the first time in India, this technique is useful for those patients who have tumor in the lung, liver or pancreas, and they have most convenience for the patients who undergo this treatment. This Radixact 9 with Synchrony technology is not known to many, whether it is patients or the other doctors other than the oncologists. So this technology, sometimes the patients come to our hospital and ask whether they are eligible for undergoing treatment in this particular machine, because they get information from various sources or online. But it is the doctor who is going to decide whether the patient is fit for this technology or whether the patient would benefit with this particular Synchrony technology. Once we see the patient and after investigating, once we have all the diagnostic reports, we see whether the patient is eligible for this particular technology, and then decide whether we can take up this patient, and we inform the patient, make them aware whether they are going to benefit from this particular technology, and then subject them for Synchrony treatment. Radixact X9 with Synchrony has the greatest advantage in tracking the tumor with the respiration. In addition to that, it also has image guided radiation capability and adaptive radiation treatment, and it is also advantageous in treating the patients wherein we have to treat a long length field, especially in children with medulloblastoma, wherein we treat craniospinal irradiation. It is also advantageous in patients who have multiple metastases either in the head, chest and pelvis, and we have to treat these three sites in one go. So in this particular machine, we can position the patient and target all these areas in one setup and one go. Whereas in other machines, probably we have to position 3 times, come inside and reposition the patient, and then we have to treat separately all these 3 sites individually. With this machine, we have the advantage that all these 3 sites or whichever multiple sites can be treated in one go. The Radixact 9 series is much faster, which has a higher energy linear accelerator, and the leaf speed or the binary MLCs are much faster, and the rotation of this machine is much faster. Thereby, with all these three things happening simultaneously, the machine can treat the patient in a shorter period of time compared to the earlier series of this helical tomotherapy.